It's like a Columbia jacket, like the inside, or what marathon runners get at the end of a race. So it's actually going to trap the patient's heat, even if they're not plugged into the blower. Just keep them warmer than even a cotton linen. It's kind of nice. And then another big change is going to be the fabric on the bottom of the blanket. So it's going to be the soft Kimberly-Clark kind of fabric material. So instead of those perforations on the bear hugger, it's actually just a woven fabric. So the heat's actually just going to evenly disperse, and we call it diffusion, right out the bottom on the patient's skin. So especially for our PEDS patients and our NICU patients who have that really sensitive skin, no hot spots, things like that, you typically won't see any redness just because it's that soft, nice fabric. Another great part about this diffusion is that when you plug the blower in, it's actually not going to lift up and float on top of the patient. So you don't need to weigh it down with linens. You don't need to tie it down. Nothing like that. It'll just lay flat like a normal cotton blanket. When inserting the hose, I always recommend you puncture fingers first. There's this nice little X. And that way we just make sure that it's not going to have trouble going into the port. And then when inserting the hose into the port, there's a nice little lip. So just make sure that it goes all the way over the lip. You'll hear kind of a click noise. So this is nice sturdy cardboard. It's actually going to hold like 4 pounds of weight, so you can be kind of tough with it if you need to, but you'll hear kind of that click noise, and that just ensures it's not going to fall out. And we have nice handy hooks. You can hook it however you want on the side. You can hook it through the bed. There's a nice little diagram on the back of each hook that kind of tells you how to use it. And then as far as the blower itself, only change is that it has a true HEPA filter, so it's going to actually be blowing really clean air, kind of like the OR ceiling quality air. Biggest change, just purple button instead. It's going to default to that 38-degree warm temp, so that's typically what we recommend. Obviously, if a patient's extremely cold, feel free to turn it up. We have 43. I know our PEDS patients tend to run a little warmer anyway, so feel free 32, or we also have an ambient air, so it's just going to be that room temp air, so it actually kind of provides a little bit of a cooling effect. So it'll inflate, nice and quiet, and then it's kind of, like I said, like a regular cotton blanket where you can manipulate it, fold it, things like that. So if a patient is really tiny and your PEDS blanket is a little bit large, you can always just tuck it down. But we always say glue to body, so just make sure that that glue is still touching the patient's skin, and that's super easy. But it's kind of like a hair dryer, so if you can turn on a hair dryer, you can turn on the blower.
So
you guys have any questions?
on top of the patient?
Yes, so this is on top.
Wrapping them in it.
No, you can, but we also have underbodies and things, which I sometimes do recommend for PEDS, but your PEDS patients are going to be running around typically more so than I've seen some that are very active. So if they're under, I'd say 9 normally, and if they're really active, I do typically recommend an underbody just because they don't have the concept of keep the blanket on, don't push it off. But if they don't need it, they're totally fine.
And you can put a blanket on top of it?
You can. We don't recommend it. It actually kind of interrupts the airflow a little bit. Okay. But if they like the weight, just for comfort, feel free. We never say no to a patient.
Okay.
But super easy.
How long can we leave this on a patient?
You can leave it on as long as needed. Obviously doing your checks, so like protocol, whatever your protocol is for every 30 minutes, an hour, whatever the check time is. Just making sure skin looks good, all that good stuff. There's a filter in it, like I said, it's going to last for 2,000 hours. Your old ones were 500. So the nice part is that you don't have to worry about leaving it on, and your filter's not just gonna go out.
Does it give us a warning when the filter is at its light?
Yep, so these are our alarms. Thanks for pointing that out. So there's a wrench. That wrench, if it lights up, it'll start kind of making a beep sound. Typically, you guys will probably end up getting a brand new blower before you ever see your filter maintenance beep. And your biomed team usually have a protocol too. I think theirs is every 6 months. They're going to change out. But if it does go off, totally fine, because again, it's that HEPA filter, so you can run it over the 2,000 hours. Just hit this little alarm button and it'll silence it, and then you can unplug it, contact biomed, and let them know. But super easy. And then these are just over-under temp alarms. The blower would be essentially broken if it was over or under. Again, contact biomed. We'll probably get you guys just a brand new blower. So if it breaks, super easy. You know, they have a form that we just send you guys a brand new one. So faceplates crack, I know. I know, you guys do way harder things than this in a day.
No, that's fine.
Without this, we have to replace it.
Right.
Yeah? No, absolutely. Of
It's only
course.
easy if you know how to use it.
Well, that's why I'm like,